You know, his O2 stats are just diminishing. He's turning blue. Look at his lips. He's non-reactive. I can't do nothing for him.
Medic 31, respond at the request of ambulance 20, one unconscious.
Go, Medic 31 responding.
Operate on section 012, $2,1300.
Dispatch to ambulance 152 received a report of a major incident, possible highway bridge collapse causing traffic accident.
Hey, what's good, everybody? Welcome back to the channel. Hope your day is going great. This is going to be another episode number 2 of the ambulance life at Paramedic Simulator. And as I mentioned on the previous video, that I am a real life licensed paramedic for the state of Texas. I've been a medic for over 20 years, and so I can kind of give some insight into the game. Now, I still understand it's still a game. There's not going to be 100% true to life. So I think most people that commented down below, they totally understand that. Now, if this video gets a lot of likes and comments, then my plan is to go ahead and purchase the $2.99 DLC. It'll give us the ability to change our branding so that we're not stuck with the same, you know, SPMR ambulance. They have a fire pack. It's like $2.99, something like that. And I thought about doing a couple of training things with you guys so you can kind of understand if you decide to play this game, that it does kind of walk you through some of the trauma scenes. We're going to go to venous bleeding. It is much different than arterial bleeding. Venous bleeding is going to be darker style of blood because it is deoxygenated blood. I think you need to know all this stuff, but you guys seem to enjoy my commentary. So we'll go ahead and do this one first. Venous blood can be extremely dangerous. You know, don't get me wrong. You have to wrap those things. It's more about compression to treat that. So this right here will kind of get you through the walkthrough, and we're going to go ahead. There's no time pressure or anything like that.
Ambulance 152, there have been reports of a bicycle accident in downtown Pelican Park. One person is bleeding heavily. Please head over immediately.
Copy that, dispatch. We're on our way there now.
You'll notice the traffic is a lot better, right? I did switch my siren to the Ottawa. You probably noticed that. It sounds a little bit better, I think, than the San Francisco one, but it's still too quiet. If I can find that file, I'm going to modify that siren. That's sort of my plan is anyway. I mean, the horn is not terribly quiet, so that's good news, right? Don't do it. Okay, so we're going to be heading over this way, and I think there's going to be it might be a bicycle accident. I'm not sure. I apologize. I thought I heard him say that, but
This should be the correct.
yeah, right there.
Let's try and locate where the
We're going to park over here. Central Medic 2's on scene. All right, let's go have a look here. Really? She's got a. She's. Don't park over there, over on the street over there. Just give me a second here, guys. Don't park over here because you can't jump. You got to walk all the way around.
Sometimes there are witnesses present around the scene of an accident. They might be able to help us with additional information. You can approach them just like patients.
All right, so I have to talk to her. And what happened?
Yeah, we were riding through the park together, like always. Suddenly, there was this huge bump in the road. I'm glad I missed that one.
Once we're done here, go and get the stretcher so we can tend to those wounds properly inside the ambulance.
Now let me talk to the patient first. She hit a rock. You can see there, and she's got a wound right there. Venous bleeding. Notice it's not spurting. Arterial bleeding will be typically spurting, although I have seen some the jugular vein kind of spurt a little bit, but that's still a different story. All right, so we kind of looked just around. Sometimes they will put helmets like over there, just kind of let you know around the scene, so that way you kind of tell if the patient has wore a helmet. She did not wear a helmet.
Everything's turning black. Thank God you're here.
Can you see what happened?
I'm not sure. I was on my bike, my usual route, and suddenly I completely lost control.
We're gonna head over here and get the stretcher. I would be more worried about her, the fact that she doesn't know what happened. You know, concussion, a head injury, things like that. But I think in this training session right here, it doesn't really go into like cervical type injuries, but she would get a neck collar for sure, because you never know. I wish that she would let me push this by myself. It would be kind of nice, but it's all right. All right, we're gonna load her up here, and notice she doesn't have a neck brace. You know what I mean? I would have put a neck brace. All right, we got her stowed, and now we're gonna move the patient over here to the ambulance. Feel a little better this way. Now this is just the training session for the venous, you know what I mean? So it's not going to be as detailed as a regular shift, you know? I was kind of showing you the differences. All right, and we're going to get in here and treat her. Pretty much the same as usual.
We should attach the usual diagnostic tools first. Afterwards, we should really take care of any bleeding wounds using the bandage tool.
All right, so we're going to go ahead and attach the pulse ox over here to her hand area there, and then we're going to flip over this way. And as I explained in the last video, it is a little bit better. You don't have to do it this way, but realistically, you want to put the blood pressure cuff on the opposite arm. If you're monitoring blood pressure on a regular basis, like every couple of minutes, it does cut off a little bit of the blood flow down the arm, and it may cut off the pulse oximeter. Okay, now she is tachycardic. I'm not worried about it. Got blood pressure. Now we can't really do, we can't give her like an O2 mask, you know, any kind of non-rebreather or nothing like that at the moment, because this is different training. Right now down here, we can apply the bandage, and it'll be right here. What is this one? Burn wound. Oh, okay, that's cool. So burn wound dressing is different than regular dressing. It is going to be a little bit moist, almost like a Vaseline. That's what that looks like in real life. This one here is dry. It's more of a compression bandage. That's all you can really do for that.
Once we've taken care of all the wounds, we should drive the patient to a hospital.
If it's really bad, you could put a tourniquet up here in real life, but I'm not worried about her blood pressure. No reason to treat all that. If you see something in yellow or even technically in red, you don't always have to treat those necessarily. Most ER doctors would prefer you not to do that in real life anyway. We're gonna head on back to the hospital. Now, if it's sky high, don't get me wrong. If it's red and like 200 over, you know, say, you know, 180 or something like that, then yeah, they would want you to probably get something on board. I wonder what kind of hypertensive medications they'll allow us to give. It'll be interesting to hear. Medics do give that quite a bit.
Let me see. We take over from here.
And they actually do take over from there.
Here are your results. This concludes our training shift together. I'm glad you're learning so quickly.
Oh yeah, I'm so glad.
Your future work will help us earn funds to provide better medical services across San Pelicano.
Well, that's good to hear. All right, now we can get
Keep it
our...
up, and I'm sure we will work together again really soon.
Oh, I look forward to that day. I look forward. that day. All right, so here's the trainings venous bleeding, got an A, and then you can see the patient results there. They didn't now. Oh, I thought they. Oh, we forgot to do that. I'm such a terrible, content creator here. Yes, I forgot to do that. So yes, I forgot. If I had done that, I'd have got it better. I'll probably an S. I forgot that they allowed us to do that for the training too. My bad, guys. Make sure you put hemorrhagic emergency and then interim diagnosis is venous bleeding. My bad. All right. I'm still confused about their blood sugar analysis right here. So just so we're clear, the pulse oximeters, the normal ones, the ones you get off Amazon, they typically will not give a blood sugar analysis. The pulse oximeters typically will have the glucose reading along with it, the brand new ones. But just so you know that, like, at least on my ambulance, we do not have that. Doctors don't believe in those. All the doctors I've talked to at the ER, they hate those things. They want us to physically stick the patient and then, get a glucose reading that way, with a finger stick. It's more accurate, in my opinion, than trying to read hemoglobin through the laser, through the light source, through the pulse ox. It's better, in my opinion. They haven't quite fine-tuned that yet. So I think the game is wanting us, get the blood sugar via the pulse ox, guys. That's what I think. That's kind of unfortunate. They ruined a big opportunity to allow us to poke the finger and just get a BS, which is blood sugar. But in the medical field, it could be referred to as a BS, a GS, glucose stick. And some doctors kind of go out of the way. They'll say FBG or something like fasting blood glucose, but it's really not accurate when I say fasting. Most people are not fasting when you're out in the field, for the most part. All right, so we're going to go ahead and do the arterial bleeding as well. Might as well do that. And then we may end up doing the one regular shift so that we can kind of see what's going on. We have not unlocked Ammon Heights, and I have not unlocked the St. Johannes. We're going to do the arterial bleeding, and I'll show you the difference.
Welcome to St. Johann. I will be your partner for the next set of training call-outs. It's nice to meet you.
I don't know, man. I kind of like this guy.
I have heard a lot of good things about you, but be aware, things are quite different in this district. A bit rougher, more intense. Let's get going. In this district, the next assignment is often only minutes away.
Well, hop in.
Ambulance 152, gunshots reported in an alley in St. Johannes. One person injured and bleeding, sending you the coordinates now.
Let's go. Go out this way.
152, Roger.
Oh, man, we may have to make this guy our partner, guys. He's too cool.
This is exactly what I meant. Hurry. The patient is probably losing a lot of blood. Take any shortcuts you can find.
Okay. Oh, man, I like this guy, man. Okay, guys, we're going to do some shortcuts. Oh, look at the AI, guys. They're getting out of the way. What? Now, this never happens in real life. Look at this. They're all running the red light so you can get by. No way. No way, guys. This is what I'm talking about, guys. I'm excited now. Trying to get to a gunshot wound. Somebody got popped. We're going to find out where the GSW is. GSWs in real life, by the way, guys, I've had to treat those many times. They are a lot different than the movies. A lot different. Depends on the caliber. Sometimes there's no bleeding hardly at all. It's strange. Depends on where they're shot at. I had one GSWs one time and there was hardly any blood at all, like zero. Just a tiny bit. Central 2, Medic 2's on scene. Now, is the scene safe? I don't know. All the medics know what I'm talking about, even EMTs as well. Oh, he is a police officer.
Looks like arterial bleeding. We have to act immediately. Select the tourniquet from your tool bag and use it to limit blood flow to the hemorrhaging limb.
Okay, there we go. I can see it better now.
Good. This should buy us some time. Some patients require immediate action.
Right lower leg. It hurts.
Your handbook later. For now, hurry and get the stretcher. We should continue treatment inside the ambulance. Time is critical.
Okay, we're just gonna go get the stretcher. We got the tourniquet on there, and time is of the essence because he needs surgery. All right, we're gonna load him up. I noticed that it plays the animation, and then other times it doesn't. Yeah, I guess it just depends. He didn't want me to go through the anamnesis. He didn't want us to do that. At least this guy, our partner. So I think we could probably just go through.
Lost a lot of blood. We should do our best to raise their blood pressure again.
Okay. We're gonna go over here and just really quickly.
Once you are done bandaging the patient, use the IV needle to gain vascular access and attach the saline solution afterwards.
Just very quickly, I usually just do this automatically before I even sit down.
Running a fever.
Well, that's the fever is the least of your worries. He's got some good juicy veins. Then we're gonna go down here and we're gonna just examine this really fast. I'm gonna check on his breathing. All right, and then we're gonna go here and then we're gonna go ahead and just wrap this really quickly. I like this little mini game they have. I kind of like that. It does make you feel like you're doing something, you know what I mean? Then we go down here and then we got it. Perfect. See how it's kind of bright red and spurting? So I can kind of tell. He's got the tourniquet up here. Just look for any other injuries. I know with this training, they want us to wrap everything. I know it sounds kind of weird to say it like that. I guess he really needs an IV. Okay, and we're gonna wrap this really quickly. We're gonna get bilateral IVs, which means both sides. And we're gonna go down this way, and we're gonna do some IV access right here. Got it. And then we're gonna administer some saline over here really quick. Now, normally in the ambulance, I think they're having a hard time, justifying, the use of saline like this, because we usually just hang a bag over the patient with the tubing, and then we call it bolus. We just open it wide open. We don't mess around with that. There's no reason to count drips and all that crap, We're gonna do another IV over here. And we're also going to give him some morphine too. Depending on his vitals, they're good. Okay, that's all good. And check, let's make sure he's doing good. Now, it will not allow me, for the training, at least for now, it will not allow me to give O2 mask. It won't let me do morphine at the moment. Okay.
Heart rate is going up.
I see that, man. Stop panicking.
Heart rate is going up.
Let's see anything else that we can do for him. We'll get some more saline over here. Although this is not, like I said, in real life. That's okay. This is showing saline like this, Like I said, we would just hang a bag and just run a bolus. And it would just flow. Depending on the lumen size of the needle. Looking. Making sure he doesn't have any other GSWs. Like gunshot wounds.
Blood pressure is getting too high. We need to do something.
Well, I can't do anything else, bud. It won't let me. Oh, I know what it wants me to do. We're gonna go ahead and just, it's a hemorrhagic emergency, and we're gonna see arterial bleeding. That part's done.
My heart, help me.
I'm trying, bud.
Oh, damn. My heart won't stop.
But the game will not allow me to do anything different at the moment. It's literally, because it's a training method, it won't let you do much more than this. I'm hoping it's not wanting us to keep pushing saline. That'd be kind of silly. Let's see, what else can we do for him? See, normal O2 saturations, which he does. His O2 sats are fine. His heart rate and his blood pressure are not good. But it will not let me do anything else. It won't even let me leave the ambulance and drive him to the hospital. Though, let me see if it will. Yeah, I see it won't let you do that. This is just the training. This is not a regular shift. All right, let's see if there's anything else we could do for him within the game standards. I just don't see any other bruising. You know what I mean? Let's see. I'm checking his entire body. Of course, I'd be rolling him over, checking his back and everything too. That's all good. I'm not seeing any blood spurting, anything else. I have no idea what they're wanting us to do here. We already know about all this.
Oxygen saturation is going down slowly.
Okay, well, you can see under the treatment, they're saying administer O2 mask, but it won't let me.
That heart won't take much more of this.
See right here, O2 mask. I won't let you do. I'm looking at all the treatments available, and we've got everything on board that I could do for him. Unfortunately,
Trouble catching my breath.
Tachypnea is this increased respiratory rate. Got some coughing, and then probably going to eventually be dyspnea, which is difficulty breathing. But I can't do anything else with the game. It won't let me. I can't even leave with him either. See exit treatment. Yeah, I won't let me do that either. Open saline solution handbook page. I've already done that. I've already done the saline solution. I've already done that. Maybe they want us to keep pushing saline. Is that what it is? It'd be kind of silly to do it that way. I really hope they don't. I want us to do that. I bet you that's what it is. They want you to keep pushing saline. Please don't tell me that's what it is. This is IV push saline. You would never do this unless you're doing a flush, you know, in between medications and things like that. Okay, blood pressure improved. Oh, please tell me that's not what it is. It needs an O2 mask, bro. It won't let me put an O2 mask on him, or even attempt to intubate him right now. I think they could do like a graphic of at least a bag near him if they're worried about the graphic problems. Just allow us to just leave the saline bag on him. You know, his O2 sats are just diminishing. He's turning blue. Look at his lips. It's non-reactive. I can't do nothing for him. This training for the arterial, anyway, it kind of sucks, to be honest. If I'm being totally honest here. All right, so he's probably going to die on me for the training because it's not really allowing me to push anything else except for saline, and I really hope that's not the case. We're doing more saline since we're under a budget cut, guys. We're under a budget cut. We're just pushing saline. That's all we're doing. That's all I could do for the guy. We're just gonna keep doing this, sir. Every time I do this, it's $100. Okay. And he's like literally dying on me. This is so silly. I want to give him like morphine and much other stuff, but I'm wondering if this is a graphic glitch, guys. I wonder if that's the case. Let me try another bandage up here, like right here. And I'm gonna try it again. If that's the case, then they may need to fix that graphic, you know? I'm gonna find out if that's what it is.
Dispatch to all viewers, spoiler alert, that's what it is.
Look at his fingers actually turning blue. That's actually a really good touch they did, but we're going to supply just bandages everywhere. You know what I mean? Oh, man. Thank you for sticking around on this fiasco. All right, perfect.
Okay, blood pressure is slowly improving.
Oh, are you
However,
serious?
Is
that what it was?
We should do something about that. Pain management is an important part of our job as well.
Are you serious? Come on, man. I didn't see anything else that needed to be done.
We should put in another IV needle and administer
I already
some
did.
morphine.
I'm way ahead of you, bud.
Pain management and the risks that come with different medications in your hand. Well done. The patient seems responsive now. I think they got lucky in that no vital organs were hit. You should still hurry to the next hospital as soon as you're ready.
Yes, and he needs to be intubated, by the way. Do that for me, thanks. So silly, guys. So if you do this training, what they gotta fix that. They really do, because how if I can't see and the game's not telling me that there is indeed another GSW there, because you wouldn't do another compression bandage like again over top of the tourniquet. You know what I mean? I don't know. Maybe I'm also missing something. Was the tourniquet was on there, right? I think it was on there, because we already applied the tourniquet. There must have been another graphic glitch. That's what it was.
Let me see. We take over from here.
Good job today. Things got quite complicated there, but you handled yourself pretty well. I'm looking forward to our next training session together.
The graphics were definitely complicated, because it didn't give me any kind of hints. You know what I mean? And I got a D on that. Are you serious? Should we repeat that? I don't know. It's almost like I want to, but I have a feeling the, you know, it may be the same. I don't know. I don't know, guys. I'm kind of contemplating. Maybe I'll do it one more time for you guys. Maybe this will be considered, you know, the training or something like that. Because I will not accept a D. You guys that know me, that have been subscribed to me for a long time, you know what I'm about to say. I have OCD. And I will not accept a D, okay? No big D for me. All right, we're going to go to the arterial bleeding one more time. And we're going to get this done. And then maybe we might do one shift, you know, with whatever happens.
Welcome to St. John's.
Yeah, I already heard that.
I will be your partner for the next set of training callouts.
Let's go. I have a feeling it's going to go to the same spot.
Ambulance 152, gunshots reported in
Aware.
Valley and St.
Things are
James.
quite
One person
different
injured
this
and bleeding.
time.
Sending you the coordinates now.
All right, let's go. We got a gunshot wound.
Let's get 152. Roger. This is exactly what I meant. Hurry.
What are you doing, bud?
The patient is probably losing a lot of blood. Take any shortcuts you can find.
All right, this time we have a mission. I will not accept anything lower than a B. We're going to wrap him up like a mummy. That's what I'm going to do. Yeah, we are using the Ottawa siren. I think it sounded a little bit better than the San Francisco one, to be honest. It's a little too quiet still. It needs to be louder. It's kind of like a beating a dead horse at the moment, because y'all heard me say that so many times. Now, typically EMS would not just go in there. Obviously, for a GSW like that, there would need to be other cops on the scene to make sure the scene is safe before they even call us in. And it's not uncommon for EMS to stage for over an hour until the scene's safe, because someone's still out there, suspect, you know. All right, Central Medic 2's on scene. All right, let's go, man. We already know what to do, right? All right, let's get this done.
Looks like arterial bleeding. We have to act immediately. Select the tourniquet from your tool bag and use it to limit blood flow to the hemorrhaging limb.
Okay, let's do this.
Good. This should buy us some time. Some patients require immediate action on site. You can read up on life-saving measures in your handbook later.
Good, I don't have time. We're gonna get this.
For now, hurry. Get the stretcher. You should continue treatment inside the ambulance.
It's funny, I'm ahead of his speech, guys. We're gonna get an A on this. We're gonna rock and roll, guys. Come on, get him in. All right, here we go. Now we kind of know what to do, what they want us to do.
Lost a lot of blood. We should do our best to raise their blood pressure again.
Yeah, just for time's sake.
Once you are done bandaging the patient, use the IV needle to gain vascular access and attach the saline solution afterwards.
Just because I could do this, I'm gonna go ahead and just put it on both sides. Like I said before, it's better if you do it on the opposite arm, but it's not a big deal here. And we're also gonna need some venous access. His blood pressure is high, not over the top, but definitely high. We're gonna rock and roll on this one, guys. All right, and then we're gonna get some saline solution. I wish they had a little bag, like I said, and just allow us to run it bolus, just wide open. We're gonna go over here and we're gonna go ahead and just bandage this really quickly, because the game kind of wants us to do that anyway. Now you see that little, you can see the kind of like a bruising look right above this wound right here. That's what I was looking for on the other guy. So far, so good. See, that's like a bruise. It looks like a bruise. It doesn't look like a GSW to me. And just because we can, we're gonna do this again over here because the game, evidently the last guy almost died on me because I didn't see the GSW. There's nothing, there was no marks or nothing. We're just gonna do the whole legs, everything, because the game's
Blood
gonna.
pressure is getting too high. We need to do something.
Yeah, I feel you on that actually. All right. Oh, that way you get the entire extremities. Now, I would not ever do this in real life, but
blood pressure slowly.
See, they want us you to do all of it, guys.
Still in a lot of pain. We should do something about that. Pain management is an important part of our job as well.
We're gonna get some morphine over here on this side.
We should put in another IV needle and administer.
I'm way ahead of you, bud.
You can read up on pain management and the risks that come with different medications in your handbook.
I am way ahead of you, man. Of course, you always ask if they're allergic to any medication before you do this.
Well done. The patient seems responsive now. I think they got lucky in that no vital organs were hit. We should still hurry to the next hospital as soon as you're ready.
I would love to do an O2 mask too, but it won't let me. So we get right here. We're gonna leave. This is just the training part of the arterial section. Then we're gonna end up going to the hospital now. I go right here, and this is right down the street. Let's go. That's pretty damn fast, right? I need probably some more saline according to the game, you know. And then you just notify Central that we are en route with the GSW. Right lower leg, vitals unstable, hypertensive tachycardia. There's a lot of other tachypnea.
Good job today. Things got quite
dyspnea.
You handled yourself pretty well. I'm looking forward to our next training session together.
All right, good. Now let's accept our. What are we gonna get here? We got an A. Actually, we got an S. So that's the highest you can get right there. All right, we got an S on that. We have unlocked a new catastrophic event, the freeway catastrophe. A new catastrophic event unlocked. A catastrophic event shift to play it. Confirm. Very cool. A gunshot. You have unlocked 30-minute shift. Nice. We'll do a 15-minute shift for this video since I've had to repeat that same, arterial section there a couple of times. And then I went through some of the, the patch notes and stuff like that. I don't want to make the video too long. But if you do like the video and you like this kind of series, we will make these 30-minute shifts, which means the video will probably be over probably close to an hour every single time. If you guys like that, the more likes that we get, the more comments that we get, then I'll know that that's what you want. Okay, we're gonna go ahead and just do a regular shift. I know we got this guy. Okay, good. I was kind of hoping we'd get somebody different. All right, now let's get on shift, and then we'll see what today brings. I think I'm going to start the fire department texture pack.
Report indicates at least one injured worker, maybe more. For ambulance 152. We received a report of a severe accident in the vicinity.
Okay, I wish they would kind of correct the dispatch talking over each other. Let's go, man. Now, this is going to be a utility accident. Now, the more you level up, the more stuff you unlock. Different call outs, different access to medications. And we'll probably get some really good cardiac event type patients eventually. I like how the AI get out of the way. It's kind of cool. Now, every call out that you get, even if it's the same call out, it doesn't mean it's going to be the same. As a matter of fact, that's the way the game is, that they typically will change up the call outs. Even though it's the same name, the outcomes will be the different, you know. Central Medic 2's on scene. All right, let's go. Let's see what this is. Obviously, that is not safe. I'd call the fire department for that, personally. Got some inflamed skin. Kind of like the first episode, right? Make sure that we're able to identify as to what is going on here. I wish I could identify what really happened to him. Make sure there's no damn live wires, I guess. That's what I would do in real life. Okay, now we can talk to him.
Pain in my right forearm.
Okay, so what's going on? The biggest thing?
Anything.
Anything? Tell me what happened.
Dunno. I was working and all went blank for a second. I think I inhaled a bit of smoke.
Okay, try to come down.
I'm starting to feel better.
If you back out and go back in again, it goes a little bit faster. Any chronic health issues?
No, nothing like this.
Okay, any prescribed medication?
Occasional back pain. No, didn't take any meds.
And then we're gonna grab our stretcher here, get him going. Now, since you're on a regular shift, you're not bound to any rules technically. You don't get, well, you do get penalized to some degree, but they give you more free will. Now, if you do badly, you can still go to the hospital. You know, you're not under strict things like the training. You know what I mean? So that's good news. All right, now let's take a look at him here. The very first thing that I'm going to do is get a pulse ox on him. And we'll come over here. You can do blood pressure on the legs if you really had to. It's not like a really big deal on that. Some of the obese patients, you would do the blood pressure if they're extremely obese. I mean, I'm talking, you know, no, I'm not trying to offend anybody, but extremely obese. You could do the blood pressure cuff right down here on the wrist area if you had to. All right, and then let's go ahead and wrap that wound because I know the game is going to want me to. But this one here, we're going to do the burn wound dressing right down here. So this one here is going to be a lot different than the dry gauze. This one here's going to be a little moist. It's almost like Vaseline gauze, if you will. And it really helps a lot to heal the wound for a burn. This one here is probably like 3rd degree. I would like to see what's underneath his pants. I know it sounds bad when I say it like that. No, I don't really want to wrap anything. I just want to look. Okay, and then let's monitor his vitals. Just want to check to make sure his airway is good. And I'm going to get an O2 mask on him too, because you mentioned something about smoke inhalation. His O2 sats, pulse rate, everything's good. And while we're here, we can go ahead and get some venous access on this side. And then we'll probably end up doing just a saline push on this. Now, in real life, I wouldn't do saline push. I'm just saying, the game, you know what I mean? His blood pressure, everything's good. He's stable. So we're gonna go here and we're gonna call this definitely environmental hazard. And then on here, it's a 3rd-degree burn. We will get some morphine. And I probably would do that, you know, in real life. But I look at vitals because the morphine is going to influence his vitals a little bit. You'll see, you'll notice here, some of these vitals will go down a little bit, but he's a pretty healthy guy. So we're going to go ahead and head on back to the hospital. And then down this way. I'm gonna go this side. All right, what do you got? This one pretty good, guys. This one went really smooth.
Let me see. We take over from here.
The wires, the developers are having a hard time, you know, making it look good. Okay, I thought we'd get a little higher than that. That's okay. Let's see here. Normal blood sugar. See, what is the deal with the blood sugar? Normal blood sugar. What does it have anything to do with what we're doing here? Apply bandages. I did do that. They might need to fix some of the graphics a little bit because I can't see all the bandages that he needs. You know what I mean? I can't just wrap him up like a damn mummy. I didn't see any other burn wound. Maybe I missed it on there, but that's okay. I'll accept it. Maybe you guys saw that. I didn't see that though.
Dispatch to ambulance 152. We need immediate response. Along for ambulance 152. Get ready for a new call out. Person in need of help.
Oh, let's do this way.
Offices. The person is described as having anxiety.
We're gonna back up. we're kind of immune to some of the rules with regular traffic. Now with the traffic density set down to low, it's a lot better in my opinion. All right, we're almost there. Don't do it. All right, here we go. And then she's gonna be down the street to the right. There's, that's the person there. Yeah, I see him. Now let's figure out what's going on here. Kind of examine the scene just a little bit, see what's going on. Just a brief glance. Make sure there's nothing. Probably a workaholic. Rapid eye movement. Okay, interesting. Make sure there's nothing else here, no drugs, anything like that. All right, so he may have like a little bit of a nystagmus, which is like where his eye is kind of jerking a little bit.
It hurts everywhere.
Everywhere? Sure about that? Okay, how can we assist you? What's going on?
I don't know. I can't catch my breath.
Okay. All right, try to calm down.
That feels better.
Here to please. Let's see here. Any chronic health issues?
No issues that I know of.
Okay, has this happened before? Or can you tell what happened?
Left work. I'm not sure what happened next.
Take any medications?
I haven't started taking anxiety pills yet, but I'm thinking about it.
Okay, and then I think we can question a witness around here too if we need to. How do you know the person here?
Will my colleague be okay?
Okay, you see what happened?
He started to panic right after we finished work. I wonder if it's related to their divorce?
She's a little Miss Nosy, Karen, right? Did anything happen to them after you called?
They are declining all help.
Okay. Do you want to go to the hospital, sir? Do you want to go? I think he wants to go now. Yes, that is the thing. Sometimes you'll show up, you know, code 3 like this, and you're getting ready to go, and then the patient declines. It happens quite frequently, actually. And I don't look at it, I don't take it personal or anything like that. Man, you may have to back up a little bit. A lot of diabetic patients do that, even if I were, you know, to get their blood sugar back in order. If they're extremely disoriented, a lot of times they decline going to the ER, and I really don't blame them, to be honest, because they probably accidentally took their insulin, and then a lot of times they forget to eat. It happens a lot, actually, quite frequently. Okay, he's a little tachycardic. I'm gonna go on the opposite arm here.
I'm having trouble.
Having trouble breathing?
Catching my breath.
Yeah.
Heart rate is going up.
Okay. Hang tight. If that helps a little bit. He's a little tachypnic. And then he probably qualifies for a little bit of an IV. We're going to probably give him some lorazepam. What I would like to give, his heart rate's pretty high. Acceptable. Wish you could do some more amnesis back here in the back of the ambulance, but I don't think it'll allow me to do that. Now, I would like to listen to his lungs as well. Let's see. Oh, here we go. Okay, that's actually normal right there. It may sound bad, but that's like a little bit of gastric type of noises, and those are completely normal. We're going to do a little bit of saline first. Pretend like I'm hanging a bag, okay? We have to RP this out a little bit, because that's what I would do, is just start a line of saline, and then I would come over here, because he qualifies for a little bit of the goofy juice. A little bit of lorazepam. This will help his heart rate. That should do the trick right there. Coughing a little bit. Hypotension. We're going to go ahead. He's got something else going on. Let's see if we have any other medications we can give him. I wonder if he may have taken some medications, I bet. No, I won't let us do anything else other than that at the moment. I don't want to put him on a ventilator, you know, just intubate him for no reason. Okay, we're probably going to go ahead and just get to the ER really fast. Now, it could be a cardiac emergency. Possible. Because he's not acting right. He's not acting like a regular He's in shock, according to this. Why does it keep unselecting that? It does appear to be, well, I would say more respiratory.
Don't delay transport.
I'm trying not to, bud. Smoke inhalation doesn't sound right. We'll say cardiac emergency with this, and then we will say shock for some reason. We're going to go with that, but it doesn't seem really crystal clear on that. I'm going to go ahead and leave. Although he probably needs to be intubated more than likely because his O2 sats are extremely on the lower end. Now let's head over to the hospital. All right, let's go. He really needs more than just a regular O2 mask. He needs to be intubated. See his pulse ox to the top right? It's 82. He's got some underlying issue going on. It's more borderline. I wouldn't say cardiac. I wish I could change that right at the moment. I'd say more respiratory. It's more reactive airway. Yeah, let's just go, man. We're gonna go. Actually, this one feels more urgent. First thing they're gonna do is intubate him.
Let me see. We take over from here.
He needs like a 12 lead EKG on him too. Okay, let's take a look and see what this is showing here. Neuropsychiatric panic. That is, I don't agree with that. I'm sorry, I just don't. A panic attack would not have done that. Sorry, it would not have to that degree anyway. So he should have been intubated more than likely, but either way, shock. I don't really agree with that one either. It's kind of a weird type of diagnosis they gave you to for option. All that was done, of course. These are all the recommended interventions. All that was done. He probably should have been intubated at that point, or maybe another dose of, well, I probably would have done another lorazepam, but either way, it was a little bit misleading. I'm being honest. I don't really agree with that one. It just didn't seem like a panic attack to me. He had something else going on, but he may have, according to the game, the way it is. So it's more than just a stress attack. According to the game, it's more of like a severe panic attack. Just could not get his breath. But usually people don't crash any that fast either. Even with lorazepam on board, he should have been calmed down quite dramatically. That probably would have went away with the lorazepam more than likely. But either way, we got him to the hospital. So thank you guys so much for watching. I really do appreciate it. And we're leveling on up here. If you do like this series, Ambulance Life for Paramedic Simulator, we got some really cool more call outs coming on, I have a feeling. And then about the next video, if this does really well, I say we do at least a 30-minute shift. If not, we may start preparing for the major catastrophe. And that is where multiple triage events and then deaths and all kinds of stuff. A lot of black tags, in other words. If you guys like this stuff, be sure to keep liking the video, leave a comment down below. That's how I'll know. And then I will see you on the next patrol. Take care and stay safe.